The following is a presentation of the Healthcare Facilities Network.
Hello, I'm Peter Martin from Gosselin Associates and the Healthcare Facilities Network. As always, thank you for clicking on this video, which happens to be episode 2 of Patient Encounters. Patient Encounters is our look at interactions of healthcare facility management professionals with patients in hospitals. As you know, if you're in the field, facilities management interacts quite frequently with patients, but our C-level leadership and people who just aren't in this field don't always appreciate the level of interaction that occurs between facilities and the patients who come into your hospitals every day. And that was the goal of this particular episode, to illustrate those interactions, to tell the stories of those interactions. And in episode 2, we have a couple of really poignant stories about interactions that have occurred from facilities people to patients in hospitals. You know, this particular episode 2, again, is one of the reasons, and I say it often, that we've created the Healthcare Facilities Network. Send this episode along. Let people know that the impact of a healthcare facility management professional, whether you are a technician going into a room or a vice president at the meeting table, you all interact with patients. Episode 2 illustrates many of those stories. So I hope you'll enjoy this episode. I hope that if this episode, if there's somebody who doesn't know what you do, you send them this episode and say, hey, this is what we do as healthcare facility management professionals. If you haven't seen episode 1, I'll link to it at the end of this episode. But as always, thank you so much for clicking on this video. Have a great day.
Really resonated with me is just seeing patients, community members, even friends in the buildings. And you had mentioned earlier just some of the things that were brought about by the pandemic and technology. And one of them that's come up several times is our HVAC systems. And people were so concerned about air quality a number of years ago. And I think there were a number of very good improvements that were made that we didn't necessarily see. And people would ask, what are you doing to ensure that your hospital is safe or ensure that your clinic is safe? And, we re-reviewed all of our HVAC systems, which were in very good shape. We do have a very robust capital investment program for replacement, so we're extremely fortunate with that. We looked at the filtration in our HVAC systems and increased that to higher efficiency wherever we could. We also began to look at UV lighting, and one of the things in particular for UV lighting in air handling units is placing these in the area of the cooling coils. And the cooling coils, of course, they sweat with the condensation that gets on them, and those can harbor bacterial microbial growth. And that not only potentially impacts your air quality downstream, but it also impacts the efficiency of the unit because you end up with this biofilm on your cooling coils, so you don't get as good of heat transfer. So in just about all of our large air handling units right now, we have UV lighting that's installed, which we've talked actively with clinical folks and infection preventionists about, and they are really on board with the air quality improvements that we're able to make. And we're seeing the benefit of better efficiency of our chiller plant and everything else. And these are things that we also wouldn't have anticipated a number of years ago. So it forced us to look at things differently and unexpectedly, and we've made improvements that we're never going to go back from.
Yeah, it's an interesting way to put it. Have you found, Steve, as you were talking about that, your relationships, not you, but the facilities relationships with, clinical partners and those other areas, have they strengthened have they changed since COVID? And if they have, how have they?
I think we did have a very good working relationship prior to, and it's everything from the construction front and capital project implementation front and working on things, risk assessments prior to construction to be sure everything is safe. But then I think they have truly seen the capabilities that we have and the things that we are able to do in ways that I guess I'll cautiously say may have been taken for granted. And just because there's an expectation that things work and we need to do whatever is asked. And we still do that, but I think we're able to do it with an explanation and much more of an enhanced partnering approach, more so than we have. And we've been able to make all of these improvements collaboratively, and people have really recognized that. And that's not just the leadership; it goes all the way to nurses and technicians, and them being able to speak with each other, I think, in different ways that they didn't years ago, and it's terrific.
Interesting. Brian.
Yeah, I probably interact with patients at least daily. Sometimes it's multiple times a day, depending on some of the concerns that may come up. And I think it's just really good practice to do that, to understand the patient's perspective and see if there's areas that we can improve upon, because we look at things through a very different lens and than a patient would or a family member would. So I think it brings a lot of value to help us understand what we can work harder to improve upon. I'll share a quick story of one of my first interactions with a patient that really was a game changer for me early in my career. And this is when I was a new manager at a hospital, and we were doing a shutdown. And of course, being the new manager, I got the short straw and had to work the overnight, right? And check on everything. And I'm going through the hospital, and I go into an ICU unit and to meet with the nurse there to make sure everything's going well with the shutdown. There's no interruptions. And out of the corner of my eye, there was a elderly woman in one of the patient rooms in the bed that was kind of facing me. And she's waving for me to come into the room. And I looked at the nurse and I said, there's a patient over there that I think wants me to come into the room. She goes, absolutely. She said she would enjoy some company. She doesn't get a lot of visitors. And being new to healthcare, I was somewhat reluctant to do it, but I said, well, I'm going to do it. So I walked into the room, and the woman said, she says, how are you? And she spoke to me as if she had known me forever. I had no idea who this woman was. And she said, you look like you have a lot of things on your mind. Is everything okay?
Wow.
And I said, well, I'm here. We have a shutdown going on. I just want to make sure that things are going well. She goes, that's nice, dear. She goes, how's the family? I said, well, my everybody's good. And that's good, dear. And the job is going well. I said, yeah, it's going well. Hopefully things will go smoothly tonight. She goes, that's good. And she talked to me for about 5 or 10 minutes. And as if we had known each other forever. It was somewhat uncanny. And I have to tell you, it was inspiring, and it definitely started to stir a lot of emotions in me, that there was this connection that I was having with a patient that I did not know. And I said, well, I have to get back to work and do some rounds and check on the rest of the hospital. And she reached over and held my hand and squeezed it. And thank you, she said, thank you so much for taking some time and speaking with me. And she says, I hope everything goes well, and take care. And it was at that moment when I realized the impact that I would have on a patient, which I never expected, right? Not only being just empathetic and compassionate and spending a few minutes, but the impact that facilities management has on everybody within that building, right? On the patients, and how meaningful it is for them. And it was an inspiring moment for me that was really a game changer and changed my perspective from just being the mechanical nuts and bolts facility manager type guy to understanding there's a whole nother realm here that we have to be cognizant of, that we do make a difference in the patient's care and what they go through when they're here, and how important it is to make sure that they're safe and comfortable.
Wow. That's a
Brian,
great story.
I have to say, I wasn't expecting you kind of teared up today during this call. Was the last thing I expected. So thank you for the surprise. But well said. Well said.
Yeah.
Yeah, it was I have to tell you, I walked back to my office and was holding back the tears myself at that moment, because I had never had that type of interaction, and it was just so unexpected.
Yeah, very perceptive, huh? On her part. I mean, on her part.
Unbelievable, unbelievable. I was speechless, and this happened over 20 years ago, and I can remember it like it was yesterday. And it just was the most life-changing experience, I guess, from a facilities manager's perspective to understand how important that connection is.
This is Peter Martin. If you or your organization is interested in advertising or partnering with the Healthcare Facilities Network, including sponsoring content, then please email me using the barcode in the lower right of your screen. From the trades level to the vice president level, from planning, design, construction, project management, compliance, safety, and security, the Healthcare Facilities Network reaches FM people where FM people are. And that's, that's kind of an example of what you don't get out of a book and what you wouldn't get out of college, because it's that real world, it's kind of the real world impact of what you do. Are there other, not that you can you're not competing with stories, but are there other examples of, that stirred me, Brian, just listening to your story, of real world instances that occur that you can't really either plan for or expect in this particular role? You don't learn about them, but you learn about them in the field. Is there anything else that along those lines that occurs or has occurred for you?
Yeah, I mean, I've had some really interesting patient experiences. I'm sure Steve and Renee have as well, right? And some go really well and some you couldn't make up. And I can tell you one quick story that a patient had been discharged, and when they left the parking lot, they got a flat tire, and they came into my office, and they were ready to tar and feather me in the office because they were so upset that they got a flat tire and it cost them $100 to get their tire replaced, and it's our fault because of the edging that came up and so forth. So I said, and this was at 5 o'clock on a Friday, just as they would something like that would happen. So I said, let me go out and take a walk with you and let's see what it is. So we did. And the whole way out to the parking lot, I'm just getting an earful of how the hospital is terrible and this should never have happened, and just getting beat up the whole way. And I said, okay, I understand. Let's just take a look. So I went out and looked at it, and I said, okay, let me take a walk over to the risk management department. Just sit tight in my office for 2 seconds. And I did. And I said, would you mind paying this patient left, got a flat tire. It's $100. Can we pay the auto shop the $100 and make them whole? And they said, yeah, we're happy to do that. No problem at all. So I went back and I said, we're more than happy to pay the $100. And they said, okay. And as I'm walking them out now out of the hospital because they're leaving, the place couldn't have been more caring and loving. It was just a wonderful place. This hospital is the best. I can't thank you. This is just fantastic. And 20 minutes ago,
Yep.
they were ready to just run me out of town. And now we couldn't do enough for them. And it was the best place. And I heard the stories about how their children have been raised, were born here. And it's just, so, it's just, sometimes it's all about perception and just taking the time.
Yeah.
But there's all kinds of patient interactions.
Yes. Anybody else?
I was probably in my early 20s and worked on this new Greenfield hospital, and it was late in the evening. I would say, probably 6:37, and I knew there was an issue with some automatic doors, and so I walked over to the medical office building and was trying to figure out what was going on, who I needed to call in the morning to get it fixed, etc. And there's a woman standing in the lobby, and she's crying, and this made a big impression on me at the time. And I just said, can I help you? And started visiting with her. Well, she was having a mental health crisis. And, back in the early 90s, we didn't really talk about that much. And so I asked her, and she said, well, my psychiatrist's office is here and he's not in the office. All the offices are closed. I don't know where to go. I tried to get her to the emergency room. She refused to go there. So I ended up sitting and talking to her in the lobby. I said, well, let's go sit down, and if you're refusing to get other care, let's go sit. And we sat and talked for probably an hour and just sat in the lobby and visited. And afterwards, she was like, I feel so much better. I'm doing well. call my doctor tomorrow and get it. She said, but thank you so much for taking the time to visit with me. And, it's probably an hour out of my day, but it made a world of difference to her. And she just needed some intervention and didn't know where to go, and ends up in the middle of this office building that's deserted for the night. So that left a big impression on me, because I was very young, and it was like, oh my gosh, I'm the only one here. What would have happened if she would have just walked in and left, and nobody would have helped her?
Yeah. Yeah. I think those examples kind of illustrate why, well, because it's the right thing to do, but you should just always treat people with dignity and respect, because you never know what interaction, like
Right.
the interaction you have with people can impact them beyond what you could ever envision. I'm sure you had no idea on either one of those days that I'm going to make this impact, but you treat people well and you treat them consistently, and it's amazing what you can do without even knowing it. It really is. Do you ever get worn down? So I'm not in hospitals as much anymore. But occasionally when we travel, just kind of walk, because they'll always want to take you. You always take the hospital tour, and you always see. But do you ever get worn down by it? Because you give births at hospitals, but you also die at hospitals, and these days hospitals are the epicenter for kind of everything that of society. Does it ever wear you down, the constant interactions and what you see on a daily basis?
It used to for me, and it used to because I previously had a focus of working on infrastructure and facilities and things, and SSM is a Catholic non-for-profit healthcare organization, and they have some of the best people that you could ever work with. And I was able to change my mindset and working with them and figuring out that these problems are going to exist in a lot of ways, and oftentimes they are not within our control. And rather than get wrapped up in that, focus on the people that you're working with and collaborate to solve these problems. And that just has an effect of lifting up your spirits, figuring out that we are truly all in this together. We can solve these problems, and then you can go home at night knowing that you've made an impact, you've done your best, it's better than the situation that you walked into. And then you jump out of bed in the morning because you get a chance to do that again.
Yeah, I like that visual there, Steve. I heard somebody, you said that, I can't remember what I was listening to. I listen to more kind of podcasts now than anything else. I don't know about you guys, but somebody said similar to that. He's like, as long as people have a reason to get up in the morning, they're probably going to get up, but you need the reason. And when you don't have that reason, it's much more difficult to make it through, to make it through your day.
Absolutely. And, if not us, who's going to solve these problems? So, there is a huge amount of satisfaction for being able to do that and keep that focus on the patient so that we can keep everything running.
Yeah. Similar for you in a community-based hospital there, Brian?
Yeah, I mean, I couldn't have said it any better. I think Steve really summed it up. You have to really understand and look at those problems really as challenges, right? And each one is a learning experience. Early in my career, there were times where they would frustrate me to some degree, but now I've learned to overcome that. And to Steve's point, and it's a challenge. And you really have to love that aspect of activity in facility, because that's the world of facilities management, right? There's never a dull day, whether it's a patient interaction or a mechanical failure or some other challenge. So that's what helps get you up every morning, because you have your list of 10 things you'd like to accomplish in the morning, and that goes out the window by 8:15.
Yeah.
And you're on to other things that have come up. So these patient interactions or that are challenging, you learn from, and each time you become more patient, a better listener, and you also have a deeper understanding of that patient's perspective and look at that as, well, how could I have done that differently? Or how could we do that better than we're currently doing? Because apparently not everybody's receiving it as we thought they would.
Yeah. Yeah. So as we come to the close of our hour, and I appreciate my guests appearing with me. Relative to the question of either patient interactions, or we've kind of also gone into mission and passion for the role. Any final thoughts along those lines? Is this role and something that people may not know about the impact? You've done a great job illustrating it, but is there anything I didn't ask about or we haven't covered, or that's kind of on your mind? You're like, any final thoughts on it?
I would say that the one thing when I'm talking to individuals about hopefully getting into this field and this career path is that first, it's not a job that's going to ever be boring. It's very dynamic, just like Brian was saying. You walk in the door and you don't know what's going to hit you every day. Every day is different. So if you like a dynamic job where it's not redundant and it's not a factory job, you're going to love this because it has a lot of challenges. And the other thing is the passion around it. I will say that I have never encountered a more passionate group of individuals than the healthcare facility managers, because it's really about a mission of providing an environment. And you're not just working with one patient or two patients, you're providing that environment for hundreds or thousands of individuals, and not just patients, but the staff, the visitors, and the passion around making sure that you're creating and supporting that environment for them to have a place to heal, or in the need, a place of refuge, whatever that is. That passion is just so strong, and it is really a calling more than a job.
Well said. Steve, Brian, you good? Or
I agree wholeheartedly, and I think one thing that we've started to do is become more active in the community. And a very recent example is working with the Boys and Girls Club of Dane County. And Dane County is Madison, Wisconsin. They have an internship program, and we were able to work with them to bring an intern to work as a maintenance technician in one of our hospitals this summer. It was just a terrific experience. We're looking forward to growing that program in the future. And now we're reaching out to other similar organizations and some of the other communities that we are located, and seeing if we can do something similar. So we're really trying to feed this and help people understand how different working in healthcare facilities is compared to some other facility.
yeah, yes, absolutely.
Yeah, I would agree. And I really love the phrase that Renee used, that it's a calling, because it really is. And it's an opportunity for people that get involved in facilities management to not only be innovative and creative and enjoy that dynamic environment, but they get to impact the patient care, right? And I mean, they are patient care supporters. And that's really something that gets overlooked, is that overall impact and how they can shape and impact the lives of those that come through the front doors of the hospital. It's really important. So it is a calling.
Yeah, yeah. No, and you guys, we talk so much about the technical competencies, and obviously you need them. And the three of you know this because you're in it, but those people skills, those communication skills, those soft skills, they're called upon just as much, because you can't isolate yourself in a basement anyway. I mean, it's just, that's not the role, right? And so you're not in a silo. You're out there very visibly. So I want to thank my guests, Renee Jacobs, Steve Borowski, Brian Croghan. Our hour flew by, but I appreciate your time. I thank you for making time to speak. Look forward to talking in the future. This is Peter Martin from the Healthcare Facilities Network. As always, I thank you for clicking on, and have a great day. Thank you for watching this episode of the Healthcare Facilities Network.